As we learned about the joints of phalanges, let's take a look at the movements that are possible at these joints. At the MCP joint, we have several movements, for example, flexion, extension, abduction, and adduction. Flexion means decreasing the angle between two joints. We have three muscles in this joint: the lumbrical, the interossei, the flexor digiti minimi only at fifth digit, as I told you before how to count the digits. Mnemonic for these muscles can be, let's investigate Frank's death, where L denotes lumbrical, I denotes interossei, and Frank's death, where F and D denotes flexor digiti minimi. Now, if there is flexion, there must be extension. Extension means increasing the angle between two joints. So let's take a look at the muscles of extension in MCP joint. We have extensor digitorum, extensor indicis only on third digit, extensor digiti minimi only on fifth digit. We can remember this as triple E's. Now let's discuss abduction and adduction. Abduction means moving away from the midpoint. Abduction takes place by the movement of dorsal interossei and abductor digiti minimi only on fifth digit. Then we have adduction. Adduction means moving towards the midpoint. Adduction by palmar interossei only on second and fourth and fifth digit is possible. Then after MCP joint, we have PIP joint. Only flexion and extension is possible here. As I told you, it's a hinge variety of synovial joint. The muscle involved in the movement of these joints are: in flexion we have flexor digitorum profundus, in extension we have lumbricals and interossei. Then here comes the last joint, which is the distal interphalangeal joint. Again, it allows flexion and extension, as it is also a hinge variety of synovial joint. And the muscles involved in this joint are: in flexion, the flexor digitorum superficialis and lumbricals. And in extension, we have, same as PIP, lumbricals and interossei. Do you know what a mallet finger is? It is a traumatic finger injury that can cause tendon ruptures that result in variety of deformities. Rupture of the extensor tendon at the distal phalanx prohibits extension of distal interphalangeal joint. The unopposed action of flexor digitorum profundus produces the characteristics called the mallet finger, deformity in which the distal phalanx remains flex. So this is it for phalanges. I hope I made it easier for you to remember and to understand how our fingers work. And remember, the harder you work for something, the greater you'll feel when you achieve it. So work hard and study harder. And if you have any questions related to this topic, do comment below and keep watching my lectures on sqadia.com.